Hello and welcome to this EDIA webinar segment in partnership with the AAE. It's a rainy day in Boston and we're going to be speaking about what I wish I knew before joining the endodontics residency. I am Dr. Anitha Abdul-Rahiman, first-year resident in endodontics at the Harvard School of Dental Medicine. And we have here with us today the remote presence of my very esteemed colleague and good friend, Dr. Kevin Kuo, fondly known as Kev, who's going to be sharing with us today what he wishes he knew before he joined the residency in endodontics at Harvard. Kevin, can you hear us?
Hey Anita, I can hear you loud and clear. The rain actually, as you can see, just let up. We got very lucky, so I can actually film this segment live for you guys. For you viewers, I am Kevin Kuo. I am also a first-year endodontic resident at Harvard. Thank you for having me.
You're welcome, Kevin, and welcome to you too. It's been 6 months into our residency, and I feel I view endodontics differently now than before. And I was curious to know if you feel the same.
Yeah, so now that I'm almost a year into my residency, I certainly view endodontics much differently. Coming in, I thought the field was much more simplified, a specialty of root canals. But we've learned a lot more procedures that we can be able to do once we graduate. The main alternative, for example, are not only retreatments, but apicoectomies, where we cut the root end tips as a surgical procedure. Alternatively, some endodontists choose to also place implants. So that's a surprising fact for a lot of people, but endodontists do place implants. And along those lines, endodontists can do pocket preservation procedures, flap surgeries. So the simplified view that I came in with is much different now that I know that we can do much more.
So one of the topics, Kevin, that I felt differently about was the application process. What's your take on that as a resident now versus before you came into the program? I know I took 3 months to write my personal statement and I still felt it wasn't enough, but you know, the deadline was approaching and I had to submit it. But what do you think about the application process now?
The application process, as you know, was certainly stressful. I agree with you. I was wondering around this time last year where I should apply, who should apply, how many letters of recommendations I need, how many PIPs, how does PASS work. But when it comes down to it, now that we know the other side of the application process when we talk to faculty, is that it is not as concerned with the details as people might think. It's really the bigger picture. If you take a look at the survey amongst program directors, their number one evaluator for their candidates is how well they interview. The number two is class rank, and number three is experience. So if you think about those things, it kind of puts things in perspective. It's to do what you can. A lot of those you can't change. You can't change your class rank. You can't change your experience. So turn in what's needed, whether it's the PASS application or supplemental applications. In the end, it's how you interview, who you are, and how good a fit they think you are in their program.
I agree with you, Kev. A residency is like one big family where everyone has to get along with each other, and it's just great when there's great chemistry involved. Would you share with our viewers where they could learn more about endodontics if they were interested?
Great question, Anita. So I know before endodontics residents actually didn't know much about the field. Kind of like what I was saying earlier, I didn't realize the field was so broad as far as procedures go. Now that I'm in the program, I know there's a lot of information out there, like the AAE website that contains information for undergraduate students to take a look, dental students. My favorite part of the website is probably the Colleges for Excellence. It's a segment of papers that the AAE releases on certain topics, for example, regenerative endodontics, coronal leakage. So those are great compilations of files that are very detailed, written with pictures and examples, and those really helped me learn the bigger picture of endodontics. Of course, there's other links to other sites on the AAE. You can find a lot of information on the application process on ADIA's website. So there's a lot of information that you can seek online to learn more about endodontics and how to apply.
Just a minute, did you say colleges of excellence? Because I don't remember applying to an AAE College of Excellence. Do you mean colleagues
Oh, correction.
for
You're right,
excellence?
Anita. It is Colleagues for Excellence and not Colleges for Excellence. Thank you for the correction.
How hard would you say are endo-level root canals? How is it different from the root canals which you did at pre-doc level, for example?
Yeah, that's a great question. One of the biggest differences that I realized was the difficulty of root canals, and it was completely different from what I did in pre-docs. So this difference can kind of go both ways for people. I know there's a subset of my classmates that really hated root canals because of their experience in dental school. They used hand files, they had to obturate bilateral condensation. So the way we do things are a little bit different. There's conveniences that we now have with rotary and warm vertical. So that's an example of a negative to a positive change. Now at the same time, this is kind of from my end where I went to see an endodontics that's a little bit more simplified to something more complicated. So a lot of the cases that we're seeing at residence and that we'll for sure see once we graduate are retreatments. That's a completely different ball game than primary treatment. The second aspect is kind of the generation of people that we're treating. A lot of my patients are elderly, and so their teeth are older as well, meaning that their pulps and canals are quite calcified. So it's harder to find, it's harder to negotiate. It is way more difficult. I really have the appreciation to our training and to our practice afterwards.
We know we have a great life here at Harvard, but maybe we want to share with our viewers how great resident life is. What is the typical day like in the life of an endodontic resident?
We certainly do have a good time here, certainly. We have a chance to even make these webinars. But I'll kind of give you an answer in kind of two perspectives. One is in a hospital-based residency and their life. So I was doing a GPR at Einstein Medical Center last year. I had an opportunity to see the program and to talk to those residents. So with a hospital-based program such as Einstein, the way their day is structured is they have class in the morning from 8 to 9, and from then they see 2 patients in the morning. After lunch, they also have an hour lecture on endodontics, and then they see 2 patients again in the afternoon. Their lectures are probably more centered on clinical endodontics and sciences of endodontics, less so with basic science like biochemistry, oral pathology. Those sort of classes are more geared towards the university programs that offer a MS degree along with their endo certificate. So Harvard is one of those. So a typical day for us as a first year depends on which day. There's some days where it's mostly classes, and some of those classes include, as mentioned before, biochemistry, physiology, immunology, oral pathology, those sort of classes. In some days we see only patients, where we see also 2 patients in the morning or 2 patients in the afternoon. So it depends on the day. And furthermore, it depends on the year too. In a lot of these MS programs are 2 years, and so their second year are mainly focused on clinic or sometimes focused more on research. Same thing with our program. Our program here is a 3-year program, so sometimes we focus more on research on the 3rd year, but all in all, the 2nd and 3rd years are mainly encompassed with clinic.
All right, Kev, thank you very much for that very informative discussion. Viewers, if you have any questions, please feel free to visit the AAE website or visit the practicing endodontist in your area for more insight into the field of endodontics. We hope to see you in our profession very soon. Then the distance that I look is...
All good.
Cool.
That's part of the blooper reel.